the Minnesota Senate Health and Human Services Finance and Policy Committee. It is Wednesday, March 18th, 2026, and we do have a quorum present. Our first bill on the agenda is Senate File 3587, Senator Pappas, and we're not taking additional testimony today. Senator Pappas came before the committee, it was a couple weeks ago, and we didn't have the final report from the Department of Health regarding the public interest review, and we have received that. And so Senator Pappas is back, and we will be taking action on the bill to send it to the floor. Senator Pappas, there is a technical amendment, the A1. It has technical changes that were requested by the reviser. And so let's move that. Senator Mann moves the A1 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Senator Pappas.
Thank you, Madam Chair. I just wanted to briefly summarize the review that the Department of Health, the Commissioner finds that the proposed expansion of 85 licensed beds is in the public interest from Commissioner Cunningham. And she lists three primary factors: that there is a needed capacity because of recent loss of inpatient bed capacity in the East Metro area and area hospitals. They all are experiencing capacity challenges visible through high occupancy and emergency department boarding. The second reason is the impact. It's unlikely that any of the other hospitals will experience significant impacts. And then the third reason is flexibility, that because there's a gradual implementation, that gives regions the flexibility that other East Metro hospitals already enjoy to gradually add the beds as they're needed. And so I'm sure you have a busy agenda, Madam Chair, so that's really all I have to say.
Great. Thank you. Any member comments or questions about it? No?
Madam Chair.
Senator Abeler.
I'm even happier about it than I was last time, so thank you.
Great. Good to know.
Way to go, Health Partners.
And Madam Chair, the President of Regents Hospital is here if you have any questions.
Okay. I don't see any member questions. I do appreciate that you are thorough in this, and I appreciate your bringing up the items that were reflected in the kind of the executive summary. And members, we didn't print the public interest review for all the members because it's quite a lengthy report, but it is available. It is linked on our committee webpage, so if you wish to read it, I think it looks like they, have reviewed all of the federal things that might be coming and how that might impact hospitals. But I agree these primary factors seem very strong in bringing forward this proposal today. So with that, seeing no other comments or discussion, members, Senator Mann moves that Senate File 3587 as amended be recommended to pass. All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and Senate File 3587 as amended is passed.
Thank you so much, Madam Chair and members.
Thank you. And now we will go to Senate File 4531.
Senator, whenever you're ready.
Thank you, Madam Chair. I guess the first thing I'd like to do is to adopt the author's amendment, the A1 amendment. It inserts dollar amounts, and then it removes one section that we did not want to have move forward.
Senator Wiklund moves the A1 author's amendment. All those in favor signify by saying aye.
Aye.
All those opposed? The amendment is adopted. Go ahead.
Thank you. Madam Chair and members, this bill, Senate File 4531, came about after some discussions last fall about what tactical things we could do to strengthen mental health services in Minnesota. And the purpose of this bill today, we are planning to have it move forward to the Judiciary Committee. They are considering many proposals relating to gun violence prevention, excuse me, and they wanted to have some ideas for mental health proposals that we could state would be good ideas to strengthen if we are able to fund any more additional mental health programs in this session. So there's appropriations for several different grant programs, and you are probably familiar with them all. They have been ones that we have been funding over the years and have proven to be particularly impactful. And so the school-linked behavioral health grants have been in great demand. The Family Peer Specialist Startup grants, also mobile crisis grants, and the mental health grants for healthcare professionals. We know that there is a need for additional workforce, and the mental health grants for healthcare professionals would help strengthen the workforce. So really that is the basis for this and why we're bringing it forward, and would like to pass it to the Judiciary Committee so that they can have it available for consideration as they take up and discuss bills. So if you have any questions, I'm happy to answer them.
Members, any questions? Senator Liskey.
Thank you, Madam Chair. Senator Wiklund, I guess my only question is, do we know how much might be left? I know that most of these appropriations were already appropriated once, and I think this is just adding funding. Is that correct?
Madam Chair, Senator Liskey, yes, this is just adding to them. I do not have the information about, current status of the funding,
Okay.
What's left right now. But these are programs that have been in particular demand, and we felt that they would be something that the money would be used efficiently.
Senator Liskey.
Thank you, Madam Chair. Thank you, Senator Wiklund. Is there any way that you could get that information? Obviously, if you don't have it today, that's fine. If you could just send that to me offline, that would be great, just so I can see where it's all at and how much that might be.
I can have our fiscal analyst take a look.
Thank you. Appreciate it.
Any other questions? Seeing none, motion for Senate File 4531 to pass and be re-referred to the Committee on Judiciary and Public Safety. All
As
those in
amended.
favor signify by saying aye.
Aye.
All those opposed? Motion prevails.
All right, thank you. Senator Abeler, would you be willing to present your Senate File 4222? Our Senator Mohamed is in another committee right now, so I'll have to come back to that one. Senator Abeler.
Well, thank you, Madam Chair, and last night we were pretty excited to go over the chiropractic bill. That was quite a moment, but this is even a bigger one. There's even a press conference yesterday from your side of the aisle working on this stuff. And there's just no shortage of effort and commitment to not have fraud in the industry here. And I think this committee wholeheartedly supports that. The commissioner comes and as I mentioned yesterday, I'm willing to posit that this is all our big deal, and I don't care who cares more or not. But at the end, we have to find a way to get the program integrity we need to make sure that the money that we're spending goes to the right place. And I'm not here to discuss the budget just yet, but if you look at what happened in the governor's budget, this committee and the other Human Service Committee took the biggest hit, thinking that there's this large pot of money. And every time we balance our budget, the thinking on the leaders who have no idea what we're doing here think there's a lagoon of money, $1 billion to extract without consequence. And that is simply not true. And in an effort to stave off that continued effort, where we're going to take that and go buy something else with it, I think we're all committed to making sure that every penny is well spent. And so the department came yesterday with their OIG bill, which you will see a lot of renditions in the versions I'm providing today. And I think that the best thing to be done, whatever jurisdiction it winds up in, this one or the other one or a combination, which is what I imagine, would be best done by us who understand this. And I think there's going to be a huge impact on what we're going to do this year in concert with the DHS OIG, and there'll be efforts elsewhere. What do we do with statewide OIG? I'm not tackling anything to do with that. This is just within the purview of human services and the 1.5 million people that we serve. And so my intention today, Madam Chair, is to take the providers have put together some legislation, which I appreciate what they're trying to do. And then my intention is to, I've done some work on due process, and talking with Mr. Clark, he says, yes, it does need some work. Oh, well, thank you. I'll take that as a compliment. At least it's maybe there's a few words like he likes a lot in that I've got there. So we're going to work with them, and it's totally compatible with just a totally, tough on fraud approach here. And so my intention, and also in the House, the other body, there's a bill that Representative Schumacher has and one that Representative Hicks has. There was a delete all to the Hicks bill, which is incorporated into amendment that I'm going to offer. So I'm bringing their whole bill into that. My work on the due process. There's a couple items I just think are not suitable for this, which I'll talk about in a minute, but maybe just while I get ready for that, if Mr. Goodnow could talk about the base bill that we're going to be, then I'll bring this other amendment as an author's amendment, and I'll be ready for that.
Mine's in the author's amendment, not in the base bill.
Oh, is that right? Yeah. Okay, well, fine. So he's anyway, so the language from the providers is in the author's amendment, but if he could describe that, I could really use a couple minutes, so.
Okay, Madam.
Mr. Goodnow.
Thank you,
welcome
Madam
to
Chair,
committee.
members
If
of the
you could
committee.
State your name for the record, and you can begin.
All right, I'm Kevin Goodnow. I am here on behalf of the Community Provider Alliance, which is a group of home and community-based service providers in Minnesota. We are supporting a portion of the delete all amendment, which would be encompassed in Article 1 of the bill, of the delete all amendment, and I can just quickly walk through that and answer any questions people might have about that. The delete all amendment is the A2 amendment. And this amendment is Senate File 4354 in its entirety, which is in a different committee, but it was incorporated into this delete all amendment. So the amendment does a number of different things. One of the things with the Community Provider Alliance is we want to make sure that there are, in this environment where fraud, waste, and abuse is talked about a lot, and it seems to be an extreme focus of the legislature and the media out there, that as we look at steps to take to reduce fraud, waste, and abuse, that we make sure there are due processes in place for providers who are being accused of that, but also making sure that we still have and maintain the integrity of the overall program so we can serve people with the frail elderly and the disabled in the community. If we go too far one way, we start shutting down the system and we start impacting access. So the intent of the bill is really, Article 1 is really to talk about, put some due process things in place, but also at the same time identify areas that we would like and support where we think there are some areas that can be improved in addressing fraud, waste, and abuse. So having said all that, I'll just walk through the issue. So, and does everybody have the delete all amendment?
Yeah. It's
Okay, good.
Yes, we do.
Otherwise, okay, all
Yeah,
right, good.
we have it in front of us. Thank you.
Because otherwise, this won't make any sense at all. So sections 1 and 2 of the bill relate to making sure that when it's a Medicaid investigation, that the procedures with regard to the investigation, the sanctions are in 256B. Right now, those investigations can be run under Chapter 15, Chapter 245, or Chapter 256B, and this is clarifying that it's just one section, that the 256B, which governs medical assistance providers and those investigations. Section 3 clarifies language based on a court case that abuse does not include billing errors that result in unintended overcharges. That's in Section 3. Sections 4, 5, 6, 7, 8, 9, 11, 12, 13, and 14 are recodification of the existing statute that is put into place, recodified for clarity. And if there are any questions regarding that recodification, I would defer to Senate Counsel, because as we were going through and came up with our ideas and what we wanted, he decided it was a good idea to clarify the statute so it's easier to understand and to read. The Section 10 is part of the bill that I want to draw your attention to. This is a restatement of Section 6 that was deleted. Section 10 is the new language, so it takes existing state statute, but it also makes some changes. So with that, I just want to highlight some of those changes. So under existing law, under 256B, when it comes to a credible allegation of fraud, it requires an indicium of reliability. What we're adding here is to make it a preponderance of the evidence. So it's it is a higher standard, it's 50% plus 1. But if they're going to make and this is with regard to making payment withholds without prior notice, and there are some exceptions, but there needs to be a preponderance of the evidence under this. That the withhold needs to have an indication that it be potentially fraudulent, that it defines fraud in this section as well, that under current law, the notice to the provider is required. This adds some specificity with regard to what the notice would require. Under current law, when the notice goes out, there's also the ability to appeal back to the commissioner for reconsideration. But a lot of the times the notices don't provide any indication of why the payments were withheld, other than a general statement, well, there's an allegation of fraud, or not even that. And so what we're asking for is that there be enough specificity so they can actually appeal and make an appeal to the commissioner about that. This is with regard to temporary payment withholds. So this is so when they have an indication of fraud, that they are able to do a payment withhold without notice and without hearing. So this limits the payment withholds to 60 days, and then that allows for some judicial overview, so there would be oversight with regard to this. So this is basically the part of Section 10, but that's the bulk of what we're talking about with regard to those changes. And I think I covered most of those. And then with the remainder of the Article 1, Sections 15 through 20, there are different sections that are directing the commissioner to study some areas. As a provider group, we didn't have the expertise to come up with all the changes that we thought were necessary, the details, but we do know there's areas where we do think there should be some improvements. Section 15 establishes a program integrity advisory board of various people in the community to provide oversight and suggestions to the commissioner with regard to program integrity. 16 is directing the commissioner to study new and improved Medicaid enrollment standards. Part of the problem we see with the fraud that we're seeing out there in the community is it's too easy to get into the program as a provider and get up and running and start billing without knowing necessarily what the requirements of the program are and the program integrity requirements. Section 17 directs the agency to look at program integrity technology modernization. Section 18 directs the commissioner to work on program structure and design audits, which look at structural incentives and misalignments, undue compliance burdens for good faith providers, regulatory and billing ambiguities, and gaps in utilization
That's
controls.
fine. It's fine.
Okay, and then Section 19, the proportional program integrity interventions. When it comes to, if there are issues with regard to fraud, waste, and abuse, we would like the sanction to match the proportionality of the impropriety that people have identified. And then Section 20 has an appropriation for the Attorney General's office, and that, I believe, will likely be coming out of the bill at some point. So that's Article 1. Happy to answer any questions. Senator Abeler, I trust you're
Yeah.
ready. Okay.
Well, Madam Chair, I think this would be a good time for the questions on Article 1. And so the reason there's Article 1.
I'm sorry, Senator Abeler, I need to recess the committee for a moment.
Oh, yeah, sure.
Thank you.
Where's the 90?
we are discussing Senator Abeler's Senate File 4222. I think you had completed your review, Mr. Goodnow. Senator Abeler, did you want to make more comments about the A2?
I do, Madam Chair, and it's, I mean, it's an author's amendment, but clearly it's not just a random amendment. And so to explain why are there two articles, I was just, I think, at that point. Anyway, and so there's two articles because between the providers and then the combination of, I guess, Hicks-Abeler language, there are incompatibilities there, and rather than torture our staff and make decisions early on, I wanted to make sure that all those thoughts are there. And then if we were going to be complete in the work that I'm trying to coalesce here, Article 3 would be what we heard from the OIG, Mr. Clark's office last night. And my intention is to go home tomorrow and have a meeting with me and just see what I think makes sense. And there's going to be some areas of conflict, and what do we want to do? I believe that should be a part of this public process within you and I and other interested parties, you know, providers, the department. I don't know if clients have thoughts about this, but maybe the client advocate groups might have a thought about some of this to make sure they're protected. That's been an issue that we really need to address somehow. More in the other committee probably, but anyway, so that's how I see this moving, and I believe at some point there's going to be a policy bill leaving here and leaving the Human Services Committee. And it may well be that that identical product goes into both of those, if that's what the agreed upon product. I'm only here as well, I have my own thoughts, but I think to facilitate a discussion with all the minds here between the research staff and the public and all of us will get us a long ways, and that's my goal. And today is the beginning of that, and I'm happy to be here presenting that. You'll notice there's a lot of overlap between Article 1 and Article 2, but we just stuck them separately just to avoid trouble. So, Madam Chair, on the A2, if I could incorporate two oral amendments on page 15.9 to delete section 20. That's the Attorney General money, which I fully think we need, but that's being handled by another committee. But I totally endorse that. So I'll incorporate that if I can.
Okay. Senator Abeler moves to amend Senate File 4222, the A2 amendment, to strike section 20. Is that correct?
That's right, yeah.
And would council like to state that in any other way? So.
Madam Chair, members, Senator Abeler moves to amend the delete everything A2 amendment to Senate File 4222, page 15, delete section 20.
Members, any discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? The oral amendment is adopted.
And Madam Chair, there's one other one.
Senator Abeler.
And, you know, we could do a lot of work today on this right now, but I don't want to take the committee's time for that. But there is one item that I just think is totally unworkable, and that's on page 26, line 12, subdivision 7, that requires that people have 90 days worth of money in the bank to operate. That is $300 million in the industry, and I just think that's just a not workable thing. So if we can just take that away as well, then I would move to delete that.
Senator Utke, can I have council to state what the amendment would be, and then, or do you have a question before that?
Actually, I do,
Senator
because
Utke.
have we moved the A2 to bring it before us
Oh,
yet?
Madam Chair, I'll move the bill in the A2.
Then we can make the
Yeah,
changes.
it was,
Thank you.
so, would Senate Council, can you state this oral amendment, please?
Madam Chair, members, Senator Abeler moves to amend the A2 delete everything amendment to Senate File 4222, page 26, delete lines 12 through 15, and then staff make conforming changes to update these subdivision numbers.
Senator Abeler, is that your motion?
That's my motion. I couldn't have said it better.
Any questions? Seeing none, all those in favor of the motion, please signify by saying aye.
Aye.
Any opposed? The oral amendment is adopted.
Well, thank you, Madam Chair. And so just to, I don't know if the members got the detail of this from staff, but I just, so there's, you'll notice a lot of these things are very compatible with what the department has brought. And so there's a great deal of effort about enrollment. There's a great deal of effort about site visits. There's a discussion in here, like last night, about risk levels, verifications and checks, background studies, service locations, and what an appropriate location is. It talks about surety bonds, and Madam Chair, that area needs some work as well, but I don't have an amendment prepared, but I can assure you that I will have a recommendation on that that will be compatible with the people that actually have to meet those. And last night, maybe I'll try to even work in something about like a preferred provider status, if we can figure out that. Because some of these providers have been serving for decades, literally. And the pressure of some of these new enrollment things are potentially unduly burdensome. So that's that. But the surety bonds is something that you'll see work on. There's a great deal of talk about compliance. The provider applications, I think that's like we did last night. Talks about suspensions, withholds, moratorium for high-risk providers. We talked about durable medical equipment providers. And there's a whole bunch of, and actually Mr. Monahan and I think Allie have spent time with recodifying a lot of this. A lot of this is a recodification. And so at some point, when we get this ready for the next presentation next week sometime, that I think it would be useful to have a highlighted version showing just what's a recodification and what's new. So, Madam Chair, that's what I have, and if you want to vote on the amendment now, we can, and then I think that's probably enough discussion for today, and then we'll take from me, and then people can comment.
So first, I guess, if you'd like to move the A2 amendment.
Madam Chair, as amended, please.
As amended. Members, all those in favor, please signify by saying aye.
Aye.
Any opposed? The A2 amendment as amended is adopted.
So I'm ready for discussion, Madam Chair.
Okay. Members, questions or comments about Senator Kupek?
Thank you, Madam Chair. Senator Abeler, thanks for doing this and doing this work. And this is really important. I know in my district, I've had providers, as you have mentioned, who have been long-time providers, and you know, the money kind of comes in and the money goes out the door, and to have that money, you know, that extra in the bank is not the way they operate. And they have been very good stewards of the people's money, and they have been, you know, meeting all the checks. So I think, yes, we don't want the pendulum to swing too far the other way. And if you can't come up with some kind of preferred provider list of people that have been doing this work for a long time and good stewards, we'll keep an eye on them still for sure, but I don't think we need to, you know, this is the whole problem I think that we've run into. It's like when a business hires a new employee, right? Like, you know, Jane over here has been with you for 20 years. You have some trust in Jane, but you know, you just hired Fred, and maybe you're going to keep a closer eye on Fred because he's new until Fred, you know, you have a relationship with Fred. And I think the more that the department could operate that way, I think the better this whole situation would be. So thanks for doing this work. I really appreciate it.
Thank you. Other member questions or comments? I don't see any, but I just had one question I wanted to bring up. I appreciate your bringing this forward with all of these ideas collected, and I think that will require, you know, discussion and kind of assessment of which ones should move forward, and I appreciate that your approach. We do need to have more conversations after this point. One question I had, though, Mr. Goodnow, when you talked about the Article 1, Section 19, about direction to Commissioner about proportional medical assistance program integrity interventions, do you think, do you foresee work happening that will involve the Attorney General's office and their Medicaid fraud unit in terms of how they have a proposal for new language to establish more of the criminal statute language? And I just wonder if there's any consideration of working with them just to make sure that, I don't know, that things are aligned or that there is communication and understanding of, you know, the roles of both parties. Mr. Goodnow.
Yeah, thank you, Madam Chair, members of the committee. Absolutely, we want to work with any impacted parties to these proposals, and anybody that has better ideas. We're definitely have no ownership in this concept. The biggest issue for us, and I know the AG's office would likely be focused on the folks at the most severe end of the spectrum with regard to the fraud, waste, and abuse. And we just want to ensure that we have a system in place where we have those appropriate measures in place for the most severe, but also have a scalable kind of sanction system for people that maybe are making errors or just need more help with regard to how to do certain things so they don't make those errors long term. So absolutely, we don't have any any pride in the ownership of the language here, and we're willing to work with any groups and to just kind of make a system that works for all of us and make sure that we take care of the people that are committing the fraud and the abusive situations, but also making sure we have due process and a good system in place to educate, bring good providers in, educate them, and make sure that they're complying with the requirements of the state. So.
Okay, thank you.
Madam Chair, to that point.
Senator Abeler.
So I think that the reason that, I can't read his mind, but known him a long time, but I think part of the reason that the providers wanted proportionality was because if the standard is indicium, that's a really low bar. And so the preponderance is language that I'll be suggesting, that they actually have to have a real reason to think. And then also with this preferred status, if we can find a way that actually doesn't, let some good actors suddenly go bad, but because they're not going to. But I think that will even ameliorate the need for that. And I also just believe that the AG gets involved with fraud, with criminal acts. And if you're just sloppy or if you're, overutilizing care, that's something that happens all the time in the healthcare administration where they argue was that appropriate or not. They just simply deny it. And I think the prepayment review process may handle a good deal of those excessive care plans, which don't rise to the level of fraud. It just rises to the level of professional opinion. Well, we thought they needed it. Well, we don't. And then you can argue about that separate. And I think the way it's kind of gone is they've been kind of commingled. And so I think as we, so that's what I think will happen here. So but it's a really insightful question. I appreciate that.
Okay, thank you. That's helpful, and I think the discussion will continue on that.
Yeah.
Members, any other conversation about this bill? I think the motion, Senator Abeler, is that Senate File 4222 as amended be recommended to pass and be referred to the Committee on Human Services.
Madam Chair, that's actually not necessary. It can actually stay here. And today we're going to have another one over there that'll look exactly like this. So I think the jurisdiction question is clunky enough that I think just leaving it here happily, then we can take it up however we decide we're going to, wherever the action work is going to be to clarify this. So that's fine with me.
All right, then we will just say that Senate File 4222 as amended is laid over.
Thank you, Madam Chair. I really appreciate the attention to this. This might be one of the marquee things we'll do this year, so thank you.
Thanks, and now we will move to Senate File 3861. Senator Mohamed. welcome to the committee, Senator Mohamed.
Thank you, Madam Chair. Madam Chair, the bill before you, Senate File 3861. Last fall, the Department of Human Services identified 14 types of services they called high-risk programs. The list gives legislators an obvious assignment. If there are 14 high-risk programs, then it's our job to cut the number 14 to 0, get rid of the phrase high risk, protect the programs, and most importantly, prioritize the hundreds of thousands of Minnesotans they keep alive and well. Senate File 3861 is ambitious, yes, but also simple. This legislation would protect the integrity of delivering high-quality care from end to end, first before a provider ever enrolls recipients, then again in lifetime as care is being delivered, and finally afterward with stronger compliance. This bill would instruct DHS to begin mandatory trainings for providers in these programs to fully inform them of existing new requirements in these services. This legislation would also require and provide for electronic visit verification, often shortened to EVV, to create a record of proof that providers are where they say, when they say, and are in fact providing care for their clients. Then last, after the care is provided, the bill has mandatory compliance trainings for providers that must include education on billing, documentation, fair labor standard, fraud prevention, and reporting. This committee knows that the financial commitments we make in this sector are significant. Across those 14 programs, the state spends hundreds of millions of dollars per month. And we cannot put a price on the values that we express through human services and through our care for our fellow Minnesotans. The issues facing recipients of care are as complex as they are vital, but our work here can be to simplify and to strengthen the delivery process in a way that puts people first and puts the public's trust back in the services Minnesotans need. And with that, Madam Chair, I think we have amendments. We can walk through the bill, actually, and Senate Council can do that.
Thank you, Senator Mohamed. Yeah, if council could go through we now have a handout with the Senate Council bill summary, and it's to the first engrossment, so I just thought it would be good if Ms. Hoffman-Litchie could go through that, walk through that, and then we'll all have a kind of a foundational knowledge of what's in the current bill. Ms. Hoffman-Litchie?
Madam Chair, members, I will first start with all of the recodification pieces. This bill primarily recodifies section 256B.04, subdivision 21. So sections 1, 2, and 6 contain technical conforming changes that for the recodification. Section 7 strikes most of the current language within that subdivision 21. Section 8 recodifies that. So subdivision 1 of section 8 contains language from paragraph J of subdivision 21 that's being recodified and contains one technical update. Subdivision 2 contains language from paragraph A along with subdivision 3. Subdivision 4 contains recodified language from paragraphs A and K. Subdivision 5 contains the recodified language from paragraph M. Subdivision 6 contains language from paragraph J. Subdivision 7 contains the recodified language from paragraph G. Subdivision 8 contains the recodified language from paragraph E. Section 9 contains revalidation language that is currently in paragraphs B and C, and Section 10 contains the provider enrollment suspension and termination language from paragraphs D, H, and I. Section 11 contains the payment withhold authority from paragraph F, and Section 13 adds the additional provider enrollment requirements that is currently in paragraphs L, G, L, and G. And then sections 14, 15, 17, and 18 further contain technical and conforming changes that update cross-references. On page 3 of your bill summary, there is a crosswalk of the recodification. The left-hand column contains where the source of the language, so from section 256B.04 subdivision 21, and then all of the paragraphs, and some are broken down at the sentence level because those paragraphs are very long. And then the right-hand column shows where that recodified language is in the bill. So moving on, the policy changes. So section 3 amends section 245A.04 subdivision 1, which is the application for licensure. It requires an applicant or license holder who elects to receive publicly funded reimbursement for providing high-risk services under its license to disclose to the Commissioner of Human Services whether the applicant or license holder received assistance in preparing the application. Section 4 prohibits the Commissioner of Human Services from issuing a license if the applicant fails to submit the required disclosure of having received the assistance that is now in Section 3 of the bill. Section 5 authorizes the Commissioner of Human Services to deny a license if the applicant again fails to submit the required disclosure that is now required in Section 3. Section 12 establishes or expands existing provider enrollment requirements for providers that are designated as a high-risk provider type. Some of these enrollment requirements already apply to high-risk providers, and the proposals in this section just expand those requirements to all high-risk provider types. Section 16 modifies the definition of service for the purpose of electronic visit verification. It now includes all services provided by high-risk provider type and to all home and community-based services reimbursed at an hourly or unit-based rate. Section 20 contains a technical change unrelated to the recodification to improve readability. Section 21 requires anyone providing direct care to a recipient of waiver services to enroll as an individual medical assistance provider and receive a unique provider identifier. Section 22 makes conforming and technical changes to paragraph A and then requires individual provider identifiers to be included in documentation of the provision of home and community-based services. Section 23 exempts equipment and supply services providers from the proposed requirement to include the individual provider identifiers in documentation now required under Section 22. Section 24 requires documentation of the individual provider identifiers, now required in Section 22, of each registered physical therapist, registered nurse, and registered dietitian who provides services to the adult day services or non-residential program. Section 25 establishes the procedures for currently enrolled high-risk providers to comply with the expanded compliance training requirements contained in the bill. Section 26 requires the Commissioner of Human Services to release the Optum report to the public with the only redactions requested by Optum to protect proprietary information. And then finally, Section 27 repeals language that would become redundant if the expanded compliance training requirements were enacted in this bill. Thank you, Madam Chair.
Thank you very much. Members, do you have any comments or questions about the bill? Any discussion? It has some similar elements to the bill we just heard, and there are other bills out there that discuss some of these same topics, but we wanted to make sure that we had a chance to talk through this bill and the others so that people are aware of the different ideas that are out there. I don't see any general questions. I do have an amendment that I believe was passed out now. It's the A4 amendment that I would like to offer. And members, this has to do with the Optum report language that is in Section 26. I have been uncomfortable with the breadth of that language and the idea that we would just publicly release the entire report with the redactions requested by Optum only. I'm not comfortable seeing the language or seeing the report just available publicly. The House has passed this bill separately, and the amendment reflects the language that was passed off the House floor. And I wanted to bring this forward to our committee for discussion. It's better. I think there could be a strengthening of this language, with some additional language about penalties if reporting or the information is disseminated. But in general, this gets closer for me to being something that I can be comfortable with, that legislators have the opportunity, certain legislators have the opportunity to review unredacted information, but they are also held to keeping that information in confidence. Members, do you have any questions or comments? Senator Liskey.
Thank you, Madam Chair. Madam Chair, I understand where you're coming from, as we've heard from the report prior when we talked about this, that they're worried that somebody will use it as a roadmap going forward. The problem is that the taxpayers paid for this information, right? It's a report that we paid for via our taxes, and the report tells us what was wrong and what went wrong. And so it should be a public thing because the public paid for it. So I would strongly urge a no vote on this amendment. I think that the way it's worded in the bill, this is necessary. I think that we need to have that report readily available so that we can understand what went wrong. And there's absolutely no reason that only a few legislators should have that information.
Other comments? Senator Mohamed, I'm sorry, I should have gone to you first.
Thank you, Madam Chair. I have been working with Senator Rasmussen on the amendment that went on our bill. I know that this language matches the House's language, which passed unanimously across the aisle, and so I'll accept the amendment. I know Rasmussen also has an individual bill that has the original language, so this language is flowing on in many places, but I don't know if we have the House language, so I'll accept this as the amendment. Thank you.
Senator Abeler.
Well, thank you, Madam Chair, and I believe this bill is going back to the Human Services Committee. That was the agreement that we had when we sent it over, I believe, and so I think it's good to kind of move the ball forward, and I think that's Senator Rasmussen is there, and that can be discussed some more in that committee. I would support the amendment today.
Senator Abeler, because this language is in here, it needs to go to judiciary first.
Oh, so, and then it would go back to Human Services.
I guess I can't say for sure what what judiciary would do, but that,
Oh, right. Well, Madam Chair, I'm just, so I haven't had time to work with the good senator on this language on the base part of the bill. But so the agreement was it would come here and then go wherever and then wind up back at the Human Services Committee. So, and
Senator Abel?
that's what I know.
Senator Mohamed.
Madam Chair, Senator Abeler, the bill has to go through judiciary because of the amendment. We will have plenty of time to work together. I told you that you'll be able to see this bill before its final passage. You have a similar one. I have a meeting with Gruenhagen next week, and so nothing is of secrecy.
Senator Abeler.
But Madam Chair, the agreement in the Human Services Committee and why it was passed unanimously out of there was that it would go back there. That's all I'm saying. So and that's compatible with what you said. So
You still have my commitment on working on the language together.
Senator Mohamed.
thank you, Madam Chair.
Senator Abeler, so you're okay with, okay.
I want to thank you for trying to find a roadmap here. At some point, we have to, find a way to get to an honorable collaboration, and I appreciate your work on this.
Thank you. Any other, Senator Radke?
Thank you, Madam Chair. And yeah, it's nice to have options in front of us, but I do believe, like Senator Liskey said, that the public is so upset with the fraud. I mean, every week it seems like, and sometimes every day they've been hit with another barrage of this is wrong and that is wrong, that this is transparency. And I think that they deserve it, and I think that would help start to move the ball forward and start getting us to a healthy position again. So I realize what you're trying to do, and if it was to come just to certain people, I think it needs to happen fast so that we can figure out a way to get it to the public, because I think the public deserves it. When they constantly hear about the billions of dollars of their tax dollars that have been fraudulently taken, there's a lot of upset people, and I think the only way we're going to start that healing is to get information out there. And I believe this is the first piece that will actually help set that roadmap forward in figuring out how to stop this and do things better in the future. So I fully realize what we're trying to do, but I think being as transparent as possible is the best way forward on this. So thank you.
Senator Mohamed?
Madam Chair, thank you, Senator Aki. I think we share in both of our understanding that that our role here is to close the loopholes so that more fraud doesn't happen. But I think you have my commitment to work on the bill that Rasmussen has to make sure that we know what's happening, because the goal of this report is to make sure that we close the loopholes. We also did hear from the agency where they said if we redact the entire report, what we could have is more fraud that can happen because we're exposing all of the ways that people can enter the system. I think we have to take both of those things into hand and make sure that we have a system that works, but also there's transparency with the public. I think this language gives legislators a pathway where they can see where the loopholes are so that we can close those and eventually maybe even release the entire report. You know, I have my own frustrations with the agency, but we also have to make sure that we don't release something at the expense of creating more fraud.
Thank you. Senator Atke, did you have?
Thank you, Madam Chair. And I just want to add my thoughts to that comment. And I don't believe at all that releasing this would be a roadmap to more fraud. Transparency is the best thing we can do. And if there's things there that expose how the fraud was done, that should just help the agency and everybody involved in state government be that much more efficient and on the forefront. So I don't honestly see a problem with transparency other than if we have trade secrets and a few of those things that do need to be held under the radar. But beyond that, again, transparency I think is our #1 friend in this case, and we need to be as transparent as possible. So thank you.
Madam Chair, Senator Aki.
Senator Mohamed?
I agree with you, which is why I think legislators should be the first ones to see the report so that we can close the loopholes before everybody sees it and then release it publicly. That's what the agency has asked for. But if the agreement is we release the entire report, it's not something I entirely am opposed to. I just want to make sure that we are closing the loopholes before we put something out there that's not ready.
Thank you. Any other questions or comments about the A4 amendment? I will just say that I believe in transparency, but I also believe that we need to be good stewards about what is non-public data, and that releasing non-public data is not something we should take lightly. I think that this amendment strikes a balance of providing us the ability to see the information and to make sure that as we consider solutions to address program integrity, that we're including what we can glean from the reports, but without jeopardizing the public, our public trust with kind of establishing a way to prevent fraud. So with that, all those in favor of the A4 amendment, please signify by saying aye. Aye. Any opposed? The motion does prevail and the amendment is adopted. Members, any other comments or questions about the bill? Senator Fateh.
Yeah, thank you, Madam Chair. I had a couple quick questions. In the testimony and also I think Senate Council, they said that for the mandatory compliance training, it's already required by some programs, but this just expands it to others. Is that correct?
Senator Mohamed.
Madam Chair, Senator Fateh, that's correct.
Okay, sounds
Senator
good.
Fateh.
No, thank you, Madam Chair. And so the training is already required for multiple programs, and it seemed to have not worked. Like HSX, for example, it was required. I think Senator Hoffman in the next bill is going to have it repealed. So is there any additional components to that can help maintain program integrity, because it seemed to have not worked with the other programs?
Senator Mohamed.
Madam Chair, Senator Fati, thank you. I think we need to have, I think what we have seen across the agency is some programs do have trainings, some don't. Some have worked, some haven't. This isn't the only legislation I have that has trainings. I also have early and often bill that'll be, I think, coming through this committee sometime. This language was worked out with nonpartisan staff. And so we want to make sure we do everything we can so that providers know what they should be doing at the very minimum. Just because it hasn't worked for one program doesn't mean it won't work across the board.
Senator Fati.
No, thank you so much. And then for the electronic monitoring component, how would it work in settings in which there are multiple units? For example, the ICS program, there are multiple apartments within one residential building. How would DHS be able to verify things in those kind of settings?
Senator Mohamed.
Thank you. That's a really good question. It's also a question that came up in the testimony by some of the providers. We know that EVV is a federal law that's used by many states that have Medicaid programs, and every state does it differently. What we know is that right now, what we're doing does not work. And maybe this program will work for certain settings and not other settings. That's a language we're going to have to work out. I am having conversations with providers to make sure that it works for everybody across the board, but what we're doing right now just does not work.
Senator Fati.
Awesome, yeah, because there's no way in which it would work in the setting like ICS, so there would have to be some kind of language that would maybe maintain the same requirement, but also ensure that it's actually working for that individual program, because one type of requirement does not fit every single program, and so we need a more tailored approach for every single one. So I'll leave it at that, Madam Chair. Thank you.
Thank you. Additional discussion about the bill? I see no other comments. Senator Mohamed, any final thoughts?
Just thank you. This is language that is, like I said in the beginning of my testimony, ambitious. We're working with as many people as we can. Obviously, this short a session. I'll get to all the conversations. I know there are many people who are worried. I will say when it comes to the EVV requirements, we want to see what other states are doing and how it's working for them. It's the position of the providers that some it won't work for, but we want to do our due diligence to make sure it works. And with that, I appreciate your time this morning.
So, members, if we are at the point of no further discussion, Senator Mann moves that Senate File 3861 as amended be recommended to pass and be referred to the Committee on Judiciary. All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and Senate File 3861 as amended is passed and referred to Judiciary. Thank you. And next we will go to Senator Hoffman, Senate File 3755.
Okay.
Senator Hoffman.
How are you, Madam Chair? It's good to be back. This is a simple bill. It addresses those several issues, Madam Chair, in the Housing Stabilization Services Program that was terminated by the governor last summer. What we want to do is codify the repeal of HHS, and the governor terminated the program due to the fraudulent activity, but the other body, this is coming from the chairs in the other body, we are going to now take the step to repeal the statute that authorizes, this is just about authorizing housing stabilization, and that brings to a second piece, which is the separation of powers. In there is the Committee on the Program Integrity and Credible Allegations of Fraud. It is clear that the funding was being misused, right? But we need to be very clear about separation of powers. Administration is one separation, the legislative branch is another one. It's the legislature that can repeal a program established in statute. People got wordsmithy this past summer. And you know, Madam Chair, I would have loved to be part of that conversation this summer, but I kind of was doing other things. And this fundamental prerogative of powers held by the legislative branch balanced against the powers of the executive. That's clearly the second piece in here. The legislative branch program, the legislative branch and the administrative branch, the executive branch may not terminate a statutory program until authorized to do so by the legislative branch. That's what what it gets to. The language in that second part also strengthens the transparency by requiring the agency to post the text of all public comments received when preparing amendments to the state's waiver plan, something we had been saying for years. Finally, the bill directs the department to begin the process of redesigning a new MA housing benefit program, and that to ensure we have a program that both supports the housing needs of Minnesotans while also centering about the robust program. People with disabilities are now, well, they've always been homeless, right? But now it's just ramped up because of what we've seen happen in there. So I know there's a technical amendment, the A6, if somebody could move that for me, I would appreciate that.
Madam Chair, I'll move that.
Senator Abeler moves the A6 amendment. Any discussion? Yes, that one is in, should be in your packet.
It's a little one.
It says, do you see it, Senator Atke? Okay. It was brought to us by the reviser, I believe, or council.
By your council. And in two. A good insert there.
Hoffman, can you describe the amendment?
Madam Chair, committee members, yes, this was brought by the reviser, these two changes that are very technical in nature.
Thank you. Any questions? Senator Atke, do you have the amendment? Okay. Any questions? All right, all those in favor of the A6 amendment, please signify by saying aye. Aye. Any opposed? The amendment is adopted.
Madam Chair,
Senator Abeler.
I have the A5 amendment that I'll move.
Senator Abeler moves the A5 amendment. Can you speak to your amendment?
Well, thank you, Mr. Chair. And so this amendment will save about $50 million, which I'd rather spend on something else. So is that how the MMB budgeting works now? We save money, we can, I think the governor now conjured up hundreds of millions of dollars in savings. Anyway, never mind. That was just for the sake of Miss Bailey there. Anyway, so in the committee, so the concern about the 2-week delay in the Human Services Committee, after some discussion, we decided to find a way to pay for that, and so to give the providers the 2 weeks that they lost, which was $53 million. And Madam Chair, just so you know, the impact on the providers was $106 million. And so at some point it turned into real money, and so that was probably an unworkable answer. So working with Mr. Pollack and others, we've come up to the idea, which is still tentative, but to do a one-time rate add-on for the cost of borrowing. And that would be only a couple $1 million. And so, Madam Chair, if this goes on, I've talked to the chair who's sitting there, then this would go back to his committee to figure out if we even find a way to pay for that. So that's, I'd move the A5.
Questions or comments? Senator Hoffman.
Yeah, thank you, Madam Chair, which just all brings up, I'll accept the A5 because it is that ongoing work that we're doing, Madam Chair. And it also brings up another issue, is that we need to assure that, you know, when you look at the governor's budget, there's all these what they call savings, but there's no credit. And Senator Abeler, you need to be aware there's no credit given to the fact that when our task force finds the savings next year, our committees could be doubly hit. We could be doubly hit if we don't get some credit on that. But no, it's a friendly amendment, Madam Chair.
Amen.
Okay, thank you. Seeing no other discussion about the amendment, all those in favor of the A5 amendment, please signify by saying aye. Aye. Any opposed? The amendment is adopted. Thank you. Any other comments or questions about the bill? Senator Fate.
Yeah, Senator Hoffman, and thank you, Madam Chair. And Senator Hoffman, I have a delete everything amendment. No, I'm joking. I want to say thank you so much for carrying this legislation and having me as a co-author. I know this is a program that's been really troubled for a long time and has been a bit of a headache for you as a chair in Human Services. So I just wanted to appreciate you for your work and thank you.
Wow.
Senator Hoffman, any?
I'm just taking it in. I've never had that, Madam Chair. That's thank you for that comment, Senator Fateh. I appreciate that. And this is work. It takes all of us. This, you know, when you look at Human Services, it's that collective work, and we all have to do the right thing. So I appreciate those comments. Thank you.
Seeing no other comments or discussion about this bill, the bill will move to the Human Services Committee. Senator Fateh moves that Senate File 3755 as amended be recommended pass and be referred to the Committee on Human Services. All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and Senate File 3755 as amended is referred to Human Services. Senator Hoffman, you have another bill, Senate File 4267.
Thank you, Madam Chair. And this is really the authority clarification that imposed sections. What this does is it recodifies. This is the work that we started doing in our committee. And this really simply is a recodification that reorganizes Section 256B.064. The section of that law allows the Department of Human Services to impose sanctions and recover money. This bill, what you see in front of you, is just that it makes the language more clear for the agency providers and courts, and it clarifies the department's ability to take swift and effective action when fraud occurs. It's, again, our collective work. I ask for your support on that. And I think this one needs to come back. Do you know where this needs to go, Anna? Don't say judiciary. Oops, I said that.
Yeah, I think
it comes back to us, doesn't it?
Yes, we can refer it back to Human Services.
Okay.
Or we can refer it to Human Services. It has not been to your committee yet.
Oh, I thought we started. Okay, no, we're good.
Yeah. Any
Thanks, Anna.
questions or comments? Seeing none, Senator Hoffman, thank you for bringing this forward. I think we've had discussion that there are a number of bills that are attempting to take some of the language and recodify it, and also bring in new concepts. And so we will work on looking at the whole playing field of bills and then figuring out what should move forward to best strengthen our program integrity efforts. So any final comments?
No, you said, Madam Chair, you said exactly what needs to happen, and that's why it's going to be, you know, when we see everything in front of us, it's going to be a really good, robust discussion about it. So I appreciate you doing that as well.
Okay, thank you. So Senator Fateh moves that Senate File 4267 be recommended to pass and referred to the Committee on Human Services. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and Senate File 4267 is passed and referred to the Committee on Human Services.
Thank you, Madam Chair and members.
Thank you. And seeing that we are at the end of our agenda, this committee is adjourned.